But first, just when, with a big sigh of relief, you thought that Australia might finally be through the worst of this corona crisis and about to begin the climb out of our self-induced economic hole, the monumental incompetence of the state Labor government in Victoria risks sending all of us backwards. No one had tougher restrictions in the first place than Victoria, yet no one has stuffed it up as badly either. And that says everything about why who you pick on the ballot paper in state elections matters so much. Brilliant at the politics, Wuhan Dan is a shocker when it comes to the work of government. Spin over substance. Officials allowed to run off with their own political agendas, political correctness ahead of policy discipline. And as we saw inside his now in administration Labor Party, no one with an eye on the detail or doing the implementation work needed to make political decisions a reality on the ground. On Saturday, I couldn't believe what I was hearing as I watched the Premier's press conference announcing he was locking down, with only a couple of hours' notice, 3,000 residents of 9 high-rise public housing estates in the centre of Melbourne. What's more, this isn't the sort of lockdown we've seen in Australia to date. What we're seeing in Melbourne is what's now being called a hard lockdown. Residents literally locked in their homes and unable to leave for any reason other than an ambulance ride perhaps to hospital. The Premier says for this inconvenience, we won't be charging them rent. Food, well, the taxpayers will pay for that too. And residents, if they can't get to work, that's another $1,500 from the state of Victoria on top of what federal taxpayers are paying for JobKeeper and JobSeeker. For those not working, well, they'll still get $750 anyway for their trouble. Toys for the children, that's coming their way. And even what's been described coyly as alcohol and other drug support, that's coming, meaning taxpayers will be looking after any addicts. Now, hearing all of this, I couldn't help thinking, imagine the outcry if it was a Liberal government locking up these public housing tenants. So how do we end up here? If you go back to the start, once we closed our international borders, the job for government was to get local transmission under control, then to carefully quarantine any returning Australians before letting them out, snuff out the disease, if you like, with the only ongoing risk, of course, being bringing new passengers home. So the biggest risk point in all of this was always hotel quarantine. So for the police not to handle this in Victoria beggars belief. And the Premier's rejection of army support only a matter of weeks ago needs a serious response, because trying to bury all of this issue in his upcoming inquiry just doesn't cut it. Now, I've been told by numerous contacts in and around the state government and, of course, the federal government in Canberra that Victoria ended up with private security contractors because Victoria Police and the police union refused to babysit, as they saw it, returning travellers. And this internal war was made worse by the turf war between the Ministers for Health and the Minister for Police and their ancillary departments. Indeed, here's the Chief Commissioner of Police in Victoria.
So I just want to be really clear, this is absolutely a Victoria Police role. In regards to the ADF, we certainly continue to explore, as we do with anything, what contingency planning means for Victoria Police and whether there are other roles that the ADF may or may not be able to be used for in the future.
Was he worried perhaps that the army turning up in Melbourne might show the police up? The fact that mums and dads in Victoria cop fines for fishing and golf going on a pier, yet 30,000 activists could march, says everything about the Victorian government's lack of focus and the priority, I have to say, of the police chieftains as well. But it gets worse. Have a look at the last month's Medical Journal of Australia. This is the May edition. In it, at the height of this pandemic, at a time when the hotel quarantine system we know now was breaking down, Victoria's Chief Medical Officer, that's Brett Sutton, well, he found time to pen a long article about his plan for hospitals and climate change. Not hospitals and coronavirus, but hospitals and climate change. And let's not forget, backing this bloke up is a deputy who doesn't know her Captain Cook from her Arthur Phillip. I know. I'm watching this unfold and I have to say it's a really, really bad episode of Yes Minister, isn't it? But unlike the TV, if you live in Victoria, you can't just turn it off and change the channels. But tonight, I have to say, for everybody else outside of Victoria, before you think this is all doom and gloom, I'm going to give you a bit of comfort. You can rest easy, because this is an outbreak, make no mistake, that could only have happened in Victoria, because this is a state with a totally dominant and unchallenged premier, with a weak and allegedly corrupted party organisation now in administration, with a demoralised and politicised public service, and a union movement, a militant union movement, accustomed to getting its way in this state. In other words, if you're not in Victoria, you're okay, because this mess could only have happened here.